We know gender diversity is important in workplaces, but in some cases, it can actually save lives. A study by the British Journal of Surgery found that Ontario hospitals with more than 35% female anesthetists and surgeons had better patient outcomes, including fewer deaths in the 3 months after an operation. CBC Health columnist Dr. Melissa Lem joins us for more insight into this. Any surprises in this?
To be honest, Dan, I'm not surprised because we see this effect in other industries like business and education, which is when we have more gender and sex diversity that teams perform better. And in fact, this follows other research that we've seen within the medical system where women physicians tend to outperform male physicians. They have lower mortality rates for their patients, fewer surgical complications. Their patients tend to access more evidence-based preventive care like pap tests and mammograms. And there was in fact a study published in the US in 2016 that showed that if male physicians performed at the same level of female physicians when it came to elder care in hospitals, that this would prevent an estimated 32,000 deaths per year.
And in particular, it focused on patient outcomes were better when patients were treated by both female anesthesiologists and surgeons. Why do you think those two fields are so critical?
Well, surgical care is a team-based kind of specialty. And so when you have more diversity on the team, you're going to see better outcomes, like I mentioned. But also women tend to be better communicators. They tend to be more collaborative. And the female advantage can also be due to the fact that women tend to follow clinical practice guidelines more often. And they tend to spend more time overall with their patients, whether it's in the OR or outside of it, which results in a higher quality of care. And so I think that more male physicians could perhaps be curious about these results and think about how they can incorporate these kinds of practice patterns into their own work to improve their own quality of care.
When it comes to getting more women into anesthesiology and surgery, you understand that there has been some barriers that are there. How would you attract more women into those two fields?
Well, one huge thing we can do is close the gender pay gap. So, for example, there was a study published just last year in the Canadian Journal of Surgery showing that a similar procedure done on a female patient compared to a male patient was on average paid about 60% less. And so there's no good reason for this other than the fact that there's been systematic underinvestment and under-prioritization of women's health in Canada, and also the women who provide the majority of that care, which deters them from entering those specialties. We can also have more women in leadership positions who are responsible for hiring and also serve as role models. And then when you think about all the years of study that women have to put in before they become surgeons and anesthetists, around that time they're launching their careers, they're also thinking about having children. So better childcare, better support for parental leave, these would all go a long way towards making these specialties more attractive. And if we put these measures in place, I think we will see better healthcare outcomes and lower healthcare costs according to the research.
Win, win, win. Interesting. Dr. Melissa Lem, we appreciate your time and your insight as always. Thanks.
Thanks, Dan.